Hello, my name is Victor Mollis and I'm a cardiologist at the University of Michigan Pulmonary Hypertension Program. In this chapter of our video series about pulmonary arterial hypertension, also called PAH, we will discuss Michigan Medicine's approach to therapy for pulmonary arterial hypertension. Treating pulmonary arterial hypertension is a team effort. You and your care partner are an important part of the team, and we will be working with a group of healthcare professionals who specialize in treating PAH. At Michigan Medicine, the PAH program functions as a multidisciplinary team. A doctor with expertise in treating PAH will provide you care, along with nurse practitioners and nurses who specialize in PAH. You may also work with our prior authorization specialist, our research coordinators, or our specialty pharmacy nurses and pharmacists who provide home teaching and monitoring for some of our therapies. The Michigan Medicine team will be communicating with your primary care doctor and your community pulmonologist or cardiologist who are also part of your team. Although there is no cure for PAH, there are medications and procedures that can slow the progression of the disease and improve your quality of life. The goals for treatment are to increase your exercise capacity, your quality of life, your ability to do activities of daily living, and your overall survival. Our goal is to decrease the severity of symptoms such as shortness of breath, fatigue, chest pain, palpitations, and dizziness. PAH medicines allow the lung blood vessels to relax, lower the blood pressures in the lungs, and make it easier for the right side of your heart to pump blood. When the heart is pumping better, your symptoms may improve and your activity level may increase. There are many medicines that treat PAH, and they come in multiple forms: pills, inhaled, and through infusions. Infusions can be done either as a subcutaneous treatment, also called sub-Q or SQ, that are given through a portable infusion pump which is infused under the skin. Other medications are infused through an intravenous pump, where the medicine is delivered through an IV. An IV is a catheter that is inserted into a vein that infuses medication directly into the bloodstream. Many people with PAH receive combination therapy. That means they take more than one medication. In addition to the specialized PAH medicines, your doctors will likely prescribe additional supportive therapies, including diuretics, to get rid of excess fluid that puts pressure on your heart. Some patients also take calcium channel blockers, or CCB, to help decrease the blood pressure. Some people also need to use oxygen, which they inhale through a cannula. Your treatment plan will be tailored to your specific situation and circumstances. Several factors determine the choice of therapy. The most important factor is the severity of your PAH. This is determined by your functional level and the risk level your PAH team assigns to your case based on various test results. The tests we do, including the 6-minute walk test, help us to determine the severity of your PAH, or what we call your functional status. PAH is a progressive disease, and our hope is that treatment will improve your symptoms and decrease the severity of your PAH. To help you understand functional status, we will explain functional classes. In early disease, functional class 1 or 2, people experience shortness of breath with heavier exertion, such as after climbing 2 flights of stairs and walking fast. As the disease progresses, people may experience shortness of breath with less exertion, such as after climbing 1 flight of stairs and doing loud house cleaning. This is classified as functional class 3. In advanced disease, or functional class 4, people may experience shortness of breath even at rest, or while doing very basic activities such as showering and dressing. Treatment for PAH is very individualized and adjusted periodically to enable you to meet goals that are important to you. These adjustments are based on your goals and results from medical tests and physical exams that you will do periodically. Our goal is to improve your symptoms and functional class with medications and lifestyle modifications. Based on your test results, the PAH team will assign a risk level to your case. This is important because the level of risk guides treatment choices. Our hope is that with treatment, we will lower the chances of your disease getting worse. Factors that contribute to a low risk are earlier stages of disease, having fewer symptoms, and preserved right heart function. Factors that contribute to a higher risk are having more advanced disease findings and having more symptoms and reduced right heart function. We will assess your risk level periodically and may revise your treatment accordingly. Other factors we consider when choosing your treatments are the method in which you will take the medications, orally, via a nebulizer, or an infusion, and how frequently you take it. We also consider the expected side effects, your preferences, the presence of other health conditions, potential drug interactions with other medications you might be taking, and your social support. Your doctor's experience and judgment is also a critical component of medication choice. To monitor your PAH, you will have a clinic visit at least every 3 months when you're newly diagnosed for a period of 1 year or more. You can expect to have the following at every clinic visit. Your PAH team will assess your symptoms. You will do a 6-minute walk test and get blood drawn. Every 6 to 12 months, you will also have an echocardiogram. You can also expect to have a right heart catheterization within the first year after starting therapy. After that, we may repeat this test if your symptoms change. Your team may order additional testing as needed. Other treatment options you may have are exercise rehabilitation programs. Studies have found that exercise capacity of people with moderately severe pulmonary hypertension improved after they participated in a formal exercise therapy program. Michigan Medicine is a premier research institution and participates in clinical trials. You may be eligible to participate in a research study or clinical trial that investigates a new therapy for PAH. If you're interested, talk to your doctor about the possibility of participating in a clinical trial. There are several therapies under investigation for PAH, and lung or heart lung transplant is also a treatment option reserved for patients who are not improving on standard medical therapies. While transplantation can prolong survival, improve quality of life, and potentially cure pulmonary arterial hypertension, it also carries a risk of significant complications, and many factors need to be considered when thinking about transplant. Between your office visits, it's very important that you pay attention to your symptoms and call us if you have any of the symptoms listed in the handout we gave you. The handout is also attached to this video. Click on the paperclip icon below the video to access it. Please call us if you have uncertainty or questions regarding your pulmonary hypertension medications. You develop new or worsening side effects from your pulmonary hypertension medication, or you develop signs of a central line infection such as redness, tenderness, drainage, fever, or chills. Also call us if you change your insurance or if you cannot get your PAH medications. Call your primary care doctor if you have symptoms of upper respiratory or another infection, if you need refills from non-PAH medications, or if you have questions regarding your non-pulmonary hypertension medications. You need to call 911 if you have severe shortness of breath or loss of consciousness if you pass out. In summary, the goal of PAH therapy is to lower the risk of your disease progressing and keep it at a low level. This can be done by personalizing medical therapy and effectively treating other medical conditions. Lifestyle modifications are also very important. We will cover this topic in the next chapter of this video series. If you have questions about pulmonary hypertension, call your healthcare provider. If you want to learn more about pulmonary hypertension care at Michigan Medicine, call 888-287-1082.